Well, welcome back, everyone. You know, chest pain can be alarming, and it's often a sign of something serious, like a heart attack. Well, today, we're talking with Dr. Arabpour about how Lima Memorial Health System is prepared to care for patients experiencing chest pain through its recent reaccreditation as an ACC chest pain center with primary PCI. So thanks so much for joining us, Doctor.
Good morning, Chris. Thank you for having me.
My pleasure. All right, Dr. Arabpour, can you explain what the ACC Chest Pain Center with primary PCI reaccreditation is and also why it matters for patients?
Chris, this is a recognition by American College of Cardiology, which basically designates you as a center that has been able to demonstrate and achieve and perhaps even surpass the minimum or the basic standards needed in order for caring for patients with a heart attack. When someone is having a heart attack, time is of essence. Time is muscle, as we say. Therefore, early diagnosis and offering them the immediate life-saving treatment is what is needed in order to achieve those goals. Being reaccredited, meaning that Lima Memorial year after year has been able to demonstrate those proficiency, those excellence in care has been able to be demonstrated to them, and therefore they recognize us as a center with those capabilities.
Yeah, so this reaccreditation, that means that Lima Memorial's ability to treat patients experience a heart attack, they can do that safely and quickly?
Yes, we actually have process in place to diagnose, and some individuals who are going to participate in the care of patient into the hospital when this happens after hours, for example, in the middle of the night. This comes with a coordination with the EMS, and then subsequently everything else that takes place within our facility is a very well coordinated sort of a orchestra, should I say. And from the moment the patient arrives all the way to the point of a discharge, all those have already been streamlined to the point of achieving two goals: excellent care, but at the same time maintaining the efficiency and expedited care, which is in a sense is going to make sure that we save as much muscle as possible in a case of a heart attack.
Right. So can you kind of explain how PCI works and then also why this procedure is, why having this procedure available 24/7 is so important for patients?
Sure. When a heart attack takes place, how quickly we reestablish the blood flow within the arteries and start feeding those muscles makes all the difference. The patient during those early minutes are very vulnerable to dangerous arrhythmia, irregular heart rhythm that could often be fatal. But beyond that, even if they survive that, if the muscle doesn't get adequate blood flow to it, the damage that takes place is going to put them as a point of having significant comorbidities and complications down the road. So quickly getting in with a PCI and opening up the artery is of essence. And as you questioned, the PCI is really a way of us gaining access to the arteries of the heart, often through a small artery in the wrist or perhaps in the groin. A very small catheter under an X-ray gets advanced to the heart. Then our equipment, which could be a balloon or a stent, gets advanced to the area of a narrowing or a blockage, and we were able to reestablish the blood flow by pushing those blockages away, and then everything is removed and life is saved, and the patient's symptoms, frankly, often immediately resolves.
Right. So many people know, of course, chest pain is a common symptom of a heart attack, but what other symptoms might be present that may need immediate medical attention?
Chris, that's a very good question. The typical symptoms, as you mentioned, is a heaviness, tightness across the chest, but a certain part of our population, especially female and those with diabetes, may experience some atypical presentation. Those could be something like a jaw discomfort, often some discomfort in epigastric or in this area of the belly that often is mistaken for maybe a stomach issues associated with a nausea, vomiting, breaking into a sweat, sometimes even having a significant discomfort between the shoulder blades, pain in the shoulder, which could go down the arms. All of these are a typical presentation and may or may not completely accompany any chest discomfort. So it's very important that if any of those symptoms are present, the patient takes the fastest and the safest route, which would be calling 911 in order to come to the hospital and be evaluated.
All right. Well, Doctor, I really appreciate you coming on the show today. Thank you so much.
Thank you. Thanks for having me.
All right. Well, don't go away because we have more when we return.